Okay, so in this picture that I've drawn out, all of the neurons that are sending out inhibitory neurotransmitters are depicted in red, and the neurons that are sending out excitatory neurotransmitters, specifically glutamine, are depicted in blue. So what I wanted to demonstrate here is you're seeing a portion of the indirect pathway in those three rows of neurons, and really the nigrostriatal pathway is fine-tuning regulating the indirect pathway. And so that's what's depicted by the SNPC, the pars compacta of the substantia nigra, sending out dopamine to those D2 receptors within the striatum, which is the putamen and caudate nucleus. So basically what's happening during Huntington's disease is that you're having destruction of some of the neurons within the striatum. So normally, if you didn't have such destruction, the indirect pathway would involve three inhibitory neurons within the series, right? So you can almost think of it as three negatives make a negative. So the overall effect of the indirect pathway, if it were acting normally, is that it would tone down or decrease the amount of muscle activity that's going on. But if you were destroying some of the neurons within the striatum, what happens is that without that first of the three inhibitory neurotransmitters, the top two rows you can think of as instead having two negatives instead of three, so you have a net positive. So even though in the third row, some of that neuron's still intact, right? So there's still some triple negative, i.e., overall negative activity being sent to the cerebral cortex. The destruction of a lot of the neurons within the striatum is having the net effect of basically having double positive, shall we say, which is going to be a net positive. Now, keep in mind, we're just looking at the indirect pathway. In Huntington's, you're still also seeing neurons within the striatum involved in the direct pathway, but I'm not showing that right here because really what I wanted to focus on is how antipsychotics work to treat Huntington's disease. So basically, what antipsychotics do, especially typical antipsychotics, is they act as D2 antagonists. They prevent dopamine from binding to the D2 receptors to, ultimately create an inhibitory signal to those whatever inhibitory neurons are left within the striatum that are still intact despite the Huntington's disease neurodegeneration. So basically, in that third row of neurons, the goal is you want to maintain that triple negative. You want to maintain that overall inhibitory signal as a way of reining in the excesses of the hyperactivity that goes on in Huntington's. Because remember, Huntington's is classified as a hyperkinesia. It's considered to be hyperkinetic disorder in which you have too much movement. So any pathway that still exists within, any series of neurons within the indirect pathway that's still sending out ultimately inhibitory signals, you want to maintain that. So as a result, you don't want the substantia nigra pars compacta to inhibit that inhibitory neuron that's still intact within the striatum that you see in row 3. So the way you prevent that disinhibition from occurring is you antagonize the D2 receptor using an antipsychotic, and thus you maintain that triple negative. Whereas if you didn't antagonize it, you would actually end up with a sort of a quadruple negative, 4 negatives if you include the SNPC, right, within that third row, and that's not something you want. You want less activity, not more activity, if you have Huntington's disease. So that's basically how antipsychotics work. And, while we're on the topic, it's sort of similar to why tetrabenazine is a useful drug for treating Huntington's as well, because recall that tetrabenazine works by ultimately preventing the neurons of the pars compacta of the substantia nigra from releasing dopamine. It basically does this by inhibiting VMAT, which prevents the VMAT normally is helping to package dopamine into the secretory vesicles that are then released from the axon terminal. If you prevent the packaging, then you're not going to get release of the dopamine.